I wasn't able to attend the meeting today, and I have a couple quick questions and some concerns. One concern, of course, is just the fact that Iowa is deciding not to accept federal money, but instead somehow we magically have enough money to fund this. But they're taking this from the social service block grant programs, and then one question is, do we know which programs exactly will be cut through that? The other question that I have, under the Senate File 2, which has been mentioned earlier, there will be 3 tiers, and how we understand this bill, Allen Women's Health will be at the bottom of the tier, and we have the staff who are trained to insert the most effective methods, IUDs and implants. And I'm wondering if there's language that can be put in the bill that any agency receiving this magical new state-funded family planning services, if the providers are required to be trained to insert IUDs and implants, because at this time, school nurses and dentists, I can't imagine, are trained to do that. And then the other suggestion would be to include the current federal guidelines. When we have, especially adolescents as patients at our clinic, we're required to screen for human trafficking, for reproductive coercion, talking with their family about sexual health, reproductive health, and are they going to continue to include those requirements with this new state family planning program that they're developing? Otherwise, we're going to be missing a lot of other services that these are concerned. So thank you so much for coming today. I really appreciate it. And again, I'm not representing Allen.
Well, just on, we're not sure where the money's going to come from. We've had the Senate Human Resources Committee, the ranking member has requested directly from the Department of Human Services where what programs are going to be cut, where the resources are going to come from, and they've been very kind of nebulous about their answers, so we're not sure. In fact, there's, as Senator Danielson mentioned earlier, there's $11.5 million cut in the budget that we didn't approve, but the majority party approved in the Senate, that we have no idea where those cuts are going to come from. They didn't know. But in order to balance the $117 million, they just threw $11.5 million fudge factor in there with nobody owning up to where those cuts are coming. So we're not sure. And you gave us some great ideas for some amendments of surety of what we need to make sure if they follow through with what they say, to make sure that these clinics are actually performing the kind of duties that need to be done in order to get the resources.